over the course of time, we all understand the price of services and goods will increase. A trip to the local grocery store can be indicative of that. We've seen dramatic increases in perishable goods of things we purchase for our families. And of course, the high gas cost has a direct impact upon what we pay for products that are shipped to us, to the stores that we go to. Another area that's seen high cost increases is the cost of healthcare. Healthcare has seen double-digit increases in the past several years. Now, meeting the healthcare needs of the American family continues to be difficult as the cost of healthcare increases. The National Coalition on Healthcare has stated that by 2009, the United States will spend $2.9 trillion on healthcare. The United States on this chart, the United States spends 16% of its gross national product on healthcare, and that was in 2005. So of course we can assume this year is possibly another percentage point higher. Now, if you look at the other countries in the chart, we see Switzerland, Germany, Canada, and France that spend a lower percent of their gross national product on healthcare. Now, these countries are not third world countries. These countries have international economies, and so, as again I state again that the 16% is very high. Now, the reasons that it's so high, several reasons are noted. Excessive use of healthcare. For example, you have possibly parents that have a new child, and if the child becomes ill for any reason, how slight it might be, they will be prompted to call their local primary care physician, who might find it difficult to diagnose over the phone, which will prompt a visit. And sometimes it's a simple cold, which can be taken care of at home. Also, there's administration costs that are associated with the increases in healthcare. There's also malpractice insurance. In 2002, the CBS Evening News put a story on a doctor by the name of Dr. Tutter. In 2002, he paid $23,000 a year for malpractice insurance. And in 2004, when this story was produced, he was quoted $84,000 a year for malpractice insurance. Now, this doctor was an OBGYN. He had estimated that he had delivered over 4,000 babies and had been a practicing physician for over 20 years. However, his malpractice insurance increased dramatically, even though he had never been sued.
I have a question.
Yes.
So doctors, like this particular doctor and other doctors, are they going to be having the same problems, and they might have to quit their practice because of the high cost of insurance?
Well, this Dr. Tutter actually did comment about that. He said in 2004 he actually said that he didn't know if he could continue on the following year because he had to pay for his office, he had to pay for staff, had to pay for their medical insurance. So of course he was also concerned. So that's a valid concern that you brought up, because this doctor had been in business for 20 years. He was very concerned about that. Now, there's also a concern about the high cost of the uninsured, what impact they have on the insured. There are many uninsured individuals that in an emergency situation will need to visit the hospital, and the hospital will, based upon the need, can waive the bill, but of course that impacts other individuals who are insured. They of course have to offset the loss in many instances, and that's also a cause why the insured customers paying higher deductibles and higher premiums. Now, with these high costs, of course the first area they go will be to the employer. If you have employer-sponsored health care, your employer pays a percent of your health care premium, and by the National Coalition on Healthcare, they have estimated that from 2001 to 2004, the insured population went from 65 million individuals to 61 million insured employees. That's a drop of 5 million individuals. So 5 million individuals lost their health insurance. And of course, with the increased cost of healthcare, this is a great burden upon the employer. And the employer typically is not in a position to be able to accept all of this added increase in cost of health insurance. So of course we'll place a portion of that financial burden will be placed upon the employee. Now the high cost of health insurance burdens employees dramatically. It's estimated, again by the National Coalition of Healthcare, they found a study that was done by Harvard University that stated that 50% of all bankruptcies had medical debt. Also, the USA Today put a story about a Crystal Cox who was 49 years old and her husband was 58 years old, and he'd been in the hospital for 5 months before he passed away and left Crystal with $20,000 in medical debt. Now, Crystal, she makes about $12,000 a year, and even though her health insurance pays 80% of the healthcare costs, that still left her with $20,000 in debt. Now again, she only makes $12,000 a year, and she works as a janitor at her local, at a local elementary school. And she was quoted as stating that oftentimes she goes without medical treatment because of the other financial requirements that she has to be responsible for.
I have a question.
Yes.
Isn't it foolish to go without medical treatment?
Yes, it's very foolish to go without medical treatment because a lot of the treatments that individuals receive are necessary for them to survive. However, a lot of individuals that skip medical treatments, it's basically, do I go to visit my doctor or do I pay my heating bill? If it's in the middle of winter time and you have children at home, of course you will not skip the heating bill or the gas bill. You will just simply skip your medical treatment. Now, Crystal Cox she fit in that group of 29% of individuals who were contacted. 29% of them said they have skipped medical treatment, possibly skipped prescriptions, cut pills in half. Now, in conclusion, there are again many inefficiencies with the current healthcare system. We see excessive use, and we see instances where there's inefficiency and fraud and waste. And this, of course, this puts a great burden upon the employee. The employee has many financial obligations to meet, and as healthcare increases, that takes a bigger chunk out of their income. And again, so because of this burden, meeting the healthcare needs of the American family continues to be a financial burden as the cost of healthcare increases.